Moving on. So, from JAVMA, from the Journal of the American Veterinary Medical Association, there is this really cool double-blinded randomized study on IM alfaxalone with or without buprenorphine or hydromorphone in healthy rabbits who were castrated. So they had a group of 24 male rabbits undergoing elective orchiectomy in 2021, and then they randomized what drugs they got. It's not blinded. They just randomized it. So first things first, this could be a sex bias study because they only looked at males. Now, it doesn't mean it's wrong because we kind of want to reduce the number of variables, right? So a male castration versus a female ovariohysterectomy, they're two very different procedures that need probably different pain management approaches if we're trying to be minimalists and we're not doing a blanket approach to everybody. So on one hand, we're excluding females from this, but it's because the procedure is much different. So it'd be really interesting to see them repeat this study with females undergoing elective spays and see if they have the same results. Because again, we don't want to ignore sex bias in any type of medicine, but we do have to kind of address the differences between the sexes as much as possible. One thing I really don't like is that there were 3 treatment groups. One group received alfaxalone alone, so no opioid. One group received alfaxalone with buprenorphine at a relatively appropriate dose, and one group received alfaxalone with hydromorphone. So I have mixed feelings about that because alfaxalone is not an analgesic, and while these animals also got ketamine, which is like, there's some NMDA agonist activity with ketamine, but it's not a strong analgesic. It's a very weak analgesic, and it's usually best when it's adjunctively used with other drugs. And they got meloxicam. It's like the low end of the dose for rabbits. We often will use 1 milligram per kilogram post-op, just because post-op pain is important to treat. So I really don't like that a third of these rabbits did not get any opioid. I'm not okay with that. That doesn't sit well with me. Like, it's a castration, but it's still painful. They should have all had some, like, I get that they're trying to compare alfaxalone versus alfaxalone with an opioid. So it kind of makes sense. Like, I get it, but I also don't like it because these animals should have appropriate pain management. So they looked at vital signs and sedation scores, which they go over the sedation scores in the appendix. So general appearance, spontaneous posture, how they responded to being placed in lateral recumbency, so lying on their side, and their jaw tone, and toe pick, so probably pinching or pricking the toe, and then their palpebral reflex. So semi-quantitative scales, that's fine, that's great. It's a good way to kind of standardize what the response is or your perception of the response. So they looked at sedation score, median time to recumbency, and ease of catheter placement, which didn't differ among groups, which kind of makes sense because you would expect that these drugs in general would have a similar, because alfaxalone is the most sedating drug effectively in this set of drugs, you would kind of expect them all to have a relatively similar response. We definitely see that IV catheter placement, it's not super painful. It's uncomfortable, but it's not super painful. So adding the opioid in with the catheter or adding the opioid in for catheter placement probably doesn't have like a great impact on how well they did, or how reactive they were, I guess. And they used supraglottic airway devices, so V-gel placement for possible in 1 rabbit in group A, 1 in group B, 2 in group. And that's not super surprising. Like, this isn't a huge dose of alfaxalone, and they're not really pairing this with... Oh, okay, but hang on. So they did do IV induction with ketamine and midazolam. But then, do they mean that they were able to place the V-gel without the ketamine midazolam here? What is happening? I'm talking about mortality. 4.8%. That's really high. They're prey animals. We know this. Ketamine IM is painful. Medetomidine-based protocols, high risk of developing laryngospasm and bradycardia. Yes, I mean if you are not expecting bradycardia with your medetomidine protocol, like your Dexdom or your dexmedetomidine or medetomidine, then you don't know how the drug works. Because that bradycardia is not necessarily dangerous because it affects cardiac output. So it increases your cardiac output, increases peripheral resistance, but you are still maintaining good cardiac output with alpha adrenergics. So, okay. So I don't know if... Okay, so they placed IV catheter. Maximum 2 attempts at each site. Yeah, that's fine. Okay, yep. So... Okay, so I guess 4 of those rabbits, they could place the V-gel after they placed the catheter, and then they used induction drugs if they couldn't place the V-gel on the injectable sedative alone. Okay, that's more clear. And they all received meloxicam prior to surgery, which is kind of ballsy. It's a short surgery, and how likely are they to become hypotensive? But still, I feel like unless like the doctor really wants the anti-inflammatory effect of an NSAID pre-op, probably wouldn't be giving it pre-op just in case you have an episode of hypotension. That makes me worry. Okay, and yeah, so no significant differences in body weight, age category, baseline physiologic variables between treatment groups. So overall, IM treatments didn't provide sufficient anesthesia to allow for supraglottic airway device placement in most rabbits, which is not a surprise. I've only seen that really effective at higher doses of alfaxalone, like probably closer to 10 mg per kg, that we're usually giving sub-Q instead of IM. Larger volumes of drugs might... Yeah, so 5 and 7 mg per kg administered IM of alfaxalone to be able to intubate rabbits. That makes a bit more sense. But yeah, the alfaxalone volume ends up being really large. So that's something that we do. I find that that's an issue with reptiles often, just because reptiles need a really high dose of alfaxalone, like 10, 15, sometimes 20 mg per kg, depending on what the species and depending on what we're doing. And you often have to split that into multiple sites just because the volume is so large. So yeah, they moved all the sedatives into one syringe, a form of compounding, which isn't incorrect, but that's a little pedantic. Okay, so yeah, they're just talking about, or they're concluding that alfaxan alone or with buprenorphine or hydromorphone provided reliable and uneventful sedation in rabbits, allowed for successful IV catheter placement, blah, blah, blah. Yeah, I would kind of expect, that's kind of what we expected. That's basically what you expect. So yay, thank you. So they all provided reliable sedation. However, alfaxan combined with hydro may be better choice for painful procedures, of course, because hydromorphone is a pure mu agonist instead of a mu and, oh gosh, kappa. Oh, I'm embarrassing myself here. Buprenorphine. That's not how you spell buprenorphine. Buprenorphine opioid receptor. Okay, yeah, I wasn't off base. Partial mu and partial mu agonist and antagonistic kappa. I wasn't full of crap. For a second, I was like, is it kappa? But it is kappa. Yeah, of course, our pure mu's are better for painful procedure management. So no big surprise. So it's not unimportant science. It's good that they have it out there. Some people can refer to it, but that's kind of what we expected.